Oh my gosh. My favorite. Come on. Snap, crackle, pop? She's screwed, and to pull it out or not to pull it out, that is the question. Today, we're breaking down and reacting to all of these shocking medical scenes and healing animations from Far Cry 6. Let's dive right in. Nice! Forearm injury, we're wrapping it with duct tape. Duct tape is used for like everything under the sun. For a potential wound dressing in an emergency, it is good. Getting it off is gonna hurt a lot, but you're in a situation where you need immediate closure of a wound, get something to stop bleeding or protection. I think that's fine. The glue on the duct tape is so good and so strong that they actually tell people they can heal plantar warts by putting duct tape on and pulling it off. Classic, popping some pills. White and blue capsules. Patients will come into the emergency department all the time and say, oh, I take the blue pill, or I take the red pill, or I take the one that looks like this. They're all different colors, shapes, and sizes, even for the same pill. They have really good apps that we have on our phones where you can look up the color, the shape, and then sometimes on these capsules or tablets, they'll actually have a number or a letter, and you can input it and you can actually figure out what the pill is. Oh, nice. The noise. Actually, sometimes it makes a pop noise. Sometimes the only noise is the person screaming. No, I'm just kidding. Typically, what we'll end up doing is not just grab and pull without any anesthesia. Sometimes a patient wants a pill to help with the pain, but a pill is going to take like a half hour, 45 minutes to an hour to get in your system. Oh, but it doesn't make that kind of noise. Typically, a shoulder dislocation that we put back in might make a clunk noise, and same with the femur putting back in place if you have a hip dislocation. Oh, we got a limp wrist. When somebody comes in with a wrist this way, I'm not thinking that it is fractured or broken or dislocated. I'm thinking like the nerve doesn't work anymore, that there's another type of injury. Kids will come into the ER with their arms like this, and it's called a nursemaid's elbow. What the treatment ends up being is just to turn it over and flex it back up. Let's see. Oh man, snap, crackle, pop. We're probably going to get an x-ray of it in the emergency department because we have time, and we want to make sure that there's no fracture, and we want to make sure that we don't cause a fracture. If there's a fragmented piece of bone in the joint space and you try to do conscious sedation and you try to then put the dislocation back together, you have a bone in the way and nothing's going to work. So then you just sedated the individual for no reason.
No reason!
Oh, let me just take out a cigar. The wound is open, bleeding, and you can't get the bleeding to stop. You're in an area where you don't have bandages. Maybe you can burn this. In the emergency department, the only time we do use heat or cauterization is typically if we're doing something called a trephination. Somebody has blood underneath a fingernail that causes a lot of pain and pressure. So you can actually just pop a small hole through the fingernail. You burn a little hole straight through it, and the blood releases. The pressure feels much better. Why would you have alcohol in the game? Maybe for pain. When that alcohol wears off, you got the headache from a withdrawal. You might feel nauseous and vomit. If you do enjoy the occasional drink, but you want to try to prevent the bad day the next day, check out Poor Decisions by Life Happens. Oh. Whoa. Small impaled object. You guys always know I say please don't pull it out, but in this circumstance you probably need to pull it out because you don't have anywhere to go to get medical care. When you pull something out that's been impaled, you have an increased risk of a major bleeding episode. But these are forearms. The likelihood of major bleeding that can't be controlled is low. Worst case scenario, you need to use a tourniquet to get the bleeding to stop. Oh. These impaled objects, they look pretty jagged. Are they metal versus like wood? Could they leave splinters in there? Maybe. Splinters eventually make themselves pushed out of the body. They eventually get out. But again, increased risk of infection. And now you have open wounds. So make sure you put bandages on this. Most of the time I tell patients to put antibiotic ointment on top of these. The ointment itself will help heal the wound. And then obviously the antibiotic component to help prevent infection. Oh man. Ouch. Palmar surface probably between the bones because it wouldn't come out so easy when a nail, kind of a nail, it's like a sharp metal object, is punctured through bone. It actually sticks pretty good. It takes a lot of effort to get it out of there versus the soft tissue. Now you have nerves that run down in that area. You also have a lot of muscles. It just causes a lot of pain. Oh, right through the palm. Puncture wounds increase the risk of getting infected. Making sure your tetanus shot is up to date is important. And then good wound care. If somebody has a bad puncture wound, we'll actually clean it out really well, but then you can't really close the wounds up because you want it to drain out, because if you seal that wound because it's a puncture wound, you have an increased risk of it becoming infected. And especially the hands where it's so far from the core, if you get infected, it takes a lot longer for it to heal versus if something is more towards the center area of your body. Oh my gosh. My favorite. Come on. Come on. We're using pliers to pull out bullets. Get the bullet out, you save the life. No. The bullet, majority of the time, isn't superficial where you can just grab it out. Obviously, if it is just simply superficial, yes. But it's typically buried within the tissue, deep in the body. And most of the time, if it's not easily accessible, it is actually left in the body. People always ask is, what about lead poisoning? That's why I tell people to avoid getting shot. And then second, you potentially can go see a plastic surgeon or a specialist to look in that area and see if it would be advisable to have it removed. Oh, looks like vomit. Oh my gosh. So everybody's vomit is pretty much a few shades of a very similar color. A brown, a clear, a yellow, a green. If you're seeing black, if you're seeing like bright red, that's very worrisome that you're having bleeding or digested blood. Oh, massive syringe, futuristic or barbaric. I can't make the difference. You got tubes and this massive needle that is pretty blunt tipped, if I have to say. That should never happen that way. Yes, we do IM injections, but we're using smaller needles and we're more gentle about it. You're direct into the bigger muscles. No. People get bitten by these type of reptiles and they lose limbs. They're very jagged. If you get the limb back, really hard to put back together. If you were to lose a limb, remember, hold pressure. If you can't control the bleeding, use a tourniquet. Whoa, shark infested water. The black tip sharks. I actually swam with black tip sharks. They're not that big, but they're like, holy crap, I am surrounded by sharks. Oh my gosh, it's got its thigh, leg. Look at this, it's, oh my gosh. Hard to tell, most likely the shark has got a hold of the upper thigh. How could you succumb to the injury if you haven't taken the leg? If you hit the femoral artery, which is right in the inguinal ligament, right at the crease of your groin, that's where a very superficial area where your femoral artery would be. And if you get that lacerated open, it's a pretty big vessel. You could bleed out pretty fast, not super fast, but pretty fast. Far Cry 6, I've done other Far Cry videos. This one has more graphics that are like appealing and bright colors versus more like caveman, you're in the jungle, different scenarios. If you guys enjoyed this, definitely check out this playlist right here. And as always, please make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.